So I want to just spend a few minutes reviewing these slides, and I'll try to go pretty quickly to give you all a chance to ask whatever questions you may have. I want to mention, first that the University of Utah is a great place to work. We have been amongst the nation's top 10 academic medical centers in quality, safety, and accountability for years. For the Vizient Quality and Accountability rankings this year, we actually are #1. We're also ranked very highly as one of America's best employees for women in Forbes. We were named #3. Many of you have probably heard word that we've just opened a brand new state-of-the-art rehabilitation hospital. So we've only been in here for a couple months now, but it's a beautiful place to work. All the patient rooms are private, very high tech. I think it's a great place to train. Here at the university in Salt Lake City, we're at an elevation of about 4,200 feet. But close by, we have mountain ranges up into the nearly 1,200 feet. We have 11 world-class ski areas within an hour's drive, 7 national parks within 5 hours, 7 national monuments, numerous wilderness areas and national forests. So it's a wonderful place to live and recreate, lots of adventures. Within our GME program, we have many different residency programs and many different fellowships. So you have opportunities to work closely with colleagues in other areas, which makes it a great place to train. We've been around, our residency program has been around for quite some time. So we were founded in 1965, but we're a very well-established but yet flexible program. We've gone from 5 to 6 residents per class, and we'll be going up to 6 to 7 residents per class now. We have very diverse training from our main hospital, the Nielsen Rehabilitation Hospital, which is connected to the University of Utah. We have the VA Medical Center, which is about a mile away. We have Primary Children's Hospital, which is connected to the main hospital. So everything is very close in proximity. Huntsman Cancer Hospital is just across the street from the Nielsen Rehabilitation Hospital. And then we have a couple of community clinics that you'll also have opportunities to work at, one in Park City and one in South Jordan. Our goal is to provide the highest quality, comprehensive training in physical medicine and rehabilitation. We strive to maintain a positive learning and working environment and teach with positive reinforcement and clear feedback. We try to maintain a really positive culture here and great relationships among residents and faculty. Our faculty are wonderful. We've actually grown in the number of faculty greatly over the last year. We've added 9 new teaching faculty. They've come from great fellowship programs. And one of the things we've really paid attention to in our recruiting and hiring is really focusing on faculty who are dedicated to teach and love to teach. Our residents, they end up going all over the country. This kind of shows where our residents have gone on to practice once they graduate. We're having more and more residents that have tended towards going to fellowships when they're done with their residency training. We've had a couple that have gone into more general PM&R, practicing at both academic and community hospitals, inpatient and outpatient. But yeah, many are having good success at matching in top fellowship programs. In terms of fellowships that we've got 6 fellowship programs here. We've got a sports medicine fellowship, spinal cord injury fellowship, interventional spine fellowship. We have a rehabilitation psychology postdoc fellowship, neuropsychology postdoc fellowship, and then a research fellowship. So lots of opportunities for fellowships, which continues to grow every year. We currently have 22 residents, but we've been approved for 26. We'll be growing gradually over the next 3 years. We have 31 full-time faculty, so many more faculty than residents, which is a great ratio for training. As I mentioned before, all of our major rotation sites are within 1.5 miles of each other, so everything is very close by. We do have scheduled didactics Thursday mornings from 8 to 12 every day. In addition to that, we have journal clubs at each rotation site, in addition to grand rounds, clinical safety case conferences, and senior symposiums. So a lot of opportunities for didactic education. There is a required scholarly activity project, which can be anything from a case study to a book chapter, to a quality improvement project, to research. We do have 1 month of elective time where you can design your own rotation for a month. We no longer have overnight call. We've recently started a night shift rotation so that nobody has to take night call when they're actually covering for a week at a time at the hospital. And that's from 5 p.m. to 7 a.m., 6 days a week for a 2-week rotation. And that's been very positively received. That was actually asked for by the residents, and they've largely designed that, that program. Scholarly activity, we do have research didactics, we do have CQI didactics, and you are provided a mentor for research and can peruse kind of the different projects that are going on, or can create your own. And there's a lot of support through our research group to help with those projects. We have a robust wellness program. Rob Davies is our GME Wellness Director, and he has worked closely for the past several years with our residents. They have scheduled a couple hours every other month, some wellness time within the didactics, as well as some outside opportunities. We have 3 residents who are our wellness champions, Susan, Sarah, and Beth, who are all on the call tonight. Dr. Steinberg is our chair. He joined our division in October of 2018, and he's been a huge asset to all of our education programs, very supportive. He's active with our recruitment efforts, our program evaluation committee, and he also runs one of our rotations, the university senior rotation. So he's very in tune with the residents. This is a listing of our rotations. So at the Nielsen Rehabilitation Hospital, we have 4 inpatient teams, a stroke service, TBI, spinal cord, as well as a new amputee service that was just recently started. There's also a U senior resident who provides supervision and support amongst all of the services. We have a consult resident as well as a clinic resident. We have 2 residents at a time at the orthopedic center doing sports and spine rotations. We have 7 residents at a time at the VA hospital. There is an inpatient unit there, as well as lots of outpatient clinical experiences. You get a ton of EMG exposure and procedural training there. At Primary Children's Hospital, it's a combination, half inpatient, half outpatient. And then, as I mentioned before, you have 1 month of elective time. We do have an 18-month didactic curriculum, so you'll get it twice during your training here. The modules cover all of the main elements of PM&R. We've also included a business of medicine practice management curriculum. As I said, wellness is built in. We have a quality improvement and research curriculum. Journal clubs at every site. I've already mentioned these other opportunities for didactic experiences. We do have a strong faculty mentorship program. We always want to be there to support and guide you. There's also mentorship within the residency program itself. So lots of opportunities for mentorship. So overall, we have a very balanced exposure to the entire scope of PM&R, from level 1 trauma centers to community clinics. Excellent procedural training, including ultrasound, spasticity management, fluoroscopic guided procedures, etc. Lots of opportunities for sports coverage, as well as adaptive sports coverage and experience. We have a very comprehensive didactic curriculum, which is faculty run. We have a devotion to scholarly activity, as well as quality improvement and patient safety. Dedication to a high quality of learning. Wonderful group of residents. I can't say enough about our residents and faculty. Really, to me, that's the highlight of this program. and a really high quality of life living in Utah. Here's just some pictures of resident life. I do want to ask you all to feel free to join us for the PM&R Wasatch Wednesdays. They'll be starting on August 19th. We'll start out with a forum on our spinal cord program, and every 2 weeks we'll be having another program focusing on a different topic. So please, if you can, feel free to join us for these. And this is some residency program contact information. So please don't hesitate to reach out to us if you have any questions that you're not able to get answered tonight. And with that, I will open things up to questions and answers. And I think probably the way to keep this most organized is if you have a question, if you can just put it in the chat box, I'll call on you in the order that your questions pop up. And you can either choose, if there's a specific person you want to answer the question, that's fine. Otherwise, I can just call on a resident or one of our residents or faculty members who are on. And I can actually just start by asking a few questions to our residents and faculty to get things. Okay, I guess the questions are coming here. So let's start with Kate Whiteneck. Would you like to answer? Would you like to ask your question? I can call on you and you can ask your question. I can ask the question. You might be muted. Would any of the residents mind talking about why they ranked the University of Utah over other programs and what stood out to you at your interview? That's a great question. Meredith, could you take a stab at that?
Sure. I mean, it really doesn't take much thought at all to answer that. The reason I chose Utah was simply because of the people. So when you look at the top tier of PM&R residency programs and what each has to offer, it really comes down to where you feel the best fit. I did a rotation as a fourth-year medical student for 2 weeks and was just amazed by the value of the teaching, the research available, the varied patient exposure, but really it came down to the people.
All right, and the next question is, thank you for talking to us tonight. How much anatomy and ultrasound times does the program dedicate for residents? Cole, would you like to take a stab at that?
Yes, certainly. So anatomy is a foundation of PM&R. So we actually are in our sports medicine module right now. A very large portion of that is anatomy based, and that's the basis of it. It extends out through, I was looking at the calendar today, I think November. So, you know, that's many, many months of this exposure. This is a didactic that you will get twice during your training. In addition, we have anatomy cadaver labs that we both actively are able to dissect, learn. Then on top of that, ultrasound more specifically. So we have a number of providers here, namely Dr. Jensen, Dr. Henry, Dr. Cushman, but almost all faculty use ultrasound, but these faculty I listed, they're doing it with nearly every procedure. So some days you could see as much as 10, 20 procedures with ultrasound. In addition, some of the sports medicine interested residents are actually running their own self-guided ultrasound curriculum. I think Meredith was the one that's really done the most work in this field.
Great, thank you. The next question is the elective rotation done in-house or can it be done at another institution? And that's kind of a quick answer. So I can just say it can be done either here or outside of here. Most of the residents end up doing a program here because we have so many faculty with fellowship training in different areas that they can find their experience here. But certainly we've had residents who have gone elsewhere as well. It's really for you to design and get the most out of what you want to during that month. Okay, thank you, Dr. Steinberg and Dr. Hansen. Any soccer coverage by any chance? I know Utah is a big soccer state. Dr. Steinberg, would you like to answer that?
Well, I do know that Dan Cushman and Stu Willick, who lead our sports program, have a tremendous connection with all the Pac-12 sports here at the U. I think we do work with the Salt Lake, Real Salt Lake, both with our neuropsychology program and also with some of our sports programs. They've been super accessible throughout Salt Lake City, and probably one of the most popular sports, since we're not a big NFL city. Certainly soccer is a big focus of the Salt Lake community. Maybe
Great.
someone else knows specifically if we cover any of the university soccer programs.
I can speak to that. We were actually, the National Women's Soccer League, their tournament was scheduled for Salt Lake this summer. It did go off. The fellows and the residents were initially allowed to provide coverage, but because of COVID, it ended up being restricted to trainers and really just one attending per game. So there's a huge opportunity for soccer coverage, both at the college and potentially the professional level.
Great.
I just want to give you guys a 4-minute warning, okay?
Okay, thank you. I'll try to get through a couple more of these questions. Sarah E.B., for any resident, what is your favorite part about living in Utah? Oh, actually, I missed one. What kind of volunteer work do your current residents do?
I can answer that one too.
Okay, we'll try to get 2 done with.
One of the cool volunteer opportunities that we have is the Trails program that Dr. Rosenbluth, one of our spinal cord injury attendings, essentially runs, and it doesn't cost anything to the participants. It allows folks that have had strokes, traumatic brain injury, spinal cord injury, basically all of our patients, to be able to do all of the fun Utah activities that we all enjoy doing. So they can go skiing, they have kayak camp every summer, they have cycling, and they provide the participants with all the equipment. And we, as residents, get all of the emails for these events, and we can go and help out anytime. And so I like to mountain bike in my free time, to answer the second question too, I guess. So have been out helping with mountain biking, and then we also have been able to kind of test out the Tetra ski that Dr. Rosenbluth developed with his engineers, and it's been very cool. And then there's I volunteer with some other kind of non-medical groups, getting women and girls outside doing all of the fun Utah activities as well with ski jumps. So many opportunities.
Awesome. Thank you, Sarah. The next question is, what were some examples of the scholarly activities the residents have done in the past? Thanks. And honestly, this one is too many to list. We have so much research going on here right now. And we actually have a research track that 4 of our residents are in, where they're doing spending a lot of time on research. So please check out our webpage. We're updating our research site so that you can see all of the different projects that are going on. And in terms of the music therapy, yes, we do have music therapy. We have a robust program up at Huntsman Cancer Hospital, and that's fabulous. So opportunities to be part of a program with music therapy. I'm trying to get through these really quick here. Let's see, being from out of state, do you have any recommendations about how to get involved with your programs virtually prior to the match? That's a great question. Brady, would you like to take a stab at that?
Yes. I would say, well, number one, those Wasatch Wednesdays are a great chance to get involved. So take a look at those. Pam put that up on the screen earlier. Also, any of the residents or the associate program director, or Pam, the program director, would also be really happy to have a conversation, either over the phone or over a Zoom call with anyone who's interested. We're going to have our website really robust, as Dr. Hansen mentioned, so there'll be a lot of information about that. But feel free to reach out to us and contact us, because we are, we know that there's a lot of extenuating circumstances this year, and we want to help you guys get a feel for our program.
1-minute warning.
Absolutely. Okay, let's see. Let's see, there's a question about any rock climbers. Yes, we have rock climbers in the program. You won't have trouble finding climbing partners. And then funding for conferences, board prep, educational stipends, moonlighting. Yes, we have funding for all of that. All of our residents are able to attend conferences as long as they've got something to present at the conference. And we do allow that time every year. There's book money every year, which is basically at this point just educational funds, so that you can select what you want to use that for. There are moonlighting opportunities. Yes. Let's see. I think that gets most of the questions there. Please feel free to reach out to us with any questions that we didn't get an opportunity to answer tonight. It's really been great sharing this time with you and being able to talk to you a little bit about our program.
Thank you so much, Dr. Hanson. Did